Okay, good morning or good afternoon, depending on what part of the country you're zooming in from. Thank you for having us here today. My name is Kara Pearson, and I'm one of the members representing Penn State University and Penn State College of Medicine here today. We are made up of engineering students, med students, and resident doctors. My peers here today are Haya, Randall, Sheikha, Annie, Shavini, Lauren, and our advisor, Dr. Chan Shen. We're excited to present our proposal, NittanyNav, to you today. NittanyNav is a resource recommender to help patients and social workers navigate the barriers to access in the healthcare system. As a brief background, diabetes has one of the highest burdens among chronic diseases, with a prevalence of 10.5% and a national cost of $327 billion. However, this burden is unequally distributed across the nation due to persistent racial and socioeconomic disparities, resulting in a lack of health equity for marginalized populations. This is why, in the first iteration of our solution, we'll be focusing on the population of diabetic patients. When diabetes is poorly controlled, the risk of diabetic retinopathy, nephropathy, and neuropathy increases. Social determinants of health, such as access to healthcare and neighborhood and community environments, are major driving forces for this health inequity. For example, food deserts would be a type of neighborhood environment that could lead to poor glucose control and therefore detrimental diabetes outcomes. Collectively, social determinants of health places a significant weight on our health system and operations. The American Diabetic Association reported that patients without health insurance have 60% fewer physician office visits, but have 168% more emergency department visits than insured patients. Therefore, addressing social determinants of health in the context of diabetes care is paramount to minimizing morbidity in individuals and to mitigate the strain put on the healthcare system. Diabetes might be our first target for implementation, but our system will expand to other chronic diseases in the future. In this slide, we illustrate the story of Sophie, who is a social worker at a local hospital. Despite that this is a fictionalized story, it illustrates a very real problem that all of us in the medical field have witnessed and been a part of. Sophie's caseload includes an entire floor of the hospital, which includes dozens of patients with complex medical issues and individualized social needs. One of Sophie's patients, Mo, needs access to a reliable food source. Sophie has an outdated list of 30 food pantries in the area, some of which are too far away, some of which are not in operation anymore, and some of which do not have enough resources or space to accommodate more patrons. It takes Sophie a long time to sort through all of these and get Mo the best resources that fits her unique needs. However, her next patient needs reliable transportation to the clinic, and another one of her patients needs safe and stable housing upon hospital discharge. Now, Sophie must repeat this process for the rest of the patients on her list. Sophie is here to help, but with so many patients and social concerns and limited time to connect them to resources, she needs assistance. With social work's increasingly heavy workload and lack of human resources, social workers have a sobering burnout rate of 39%. This means that Sophie physically does not have enough time in the day to do everything on her list for her patients. The social aspects of patients' care are often the most important factors on patient outcomes, and an area in which we as healthcare providers are sometimes ill-equipped to provide support in. Our team also reached out to a local social worker to provide feedback on our idea. She was very excited about our idea and said that she thinks this would save her and her colleagues a lot of time during their workday. She also gave great feedback on the types of features we can include in the system to help make her and her patients' lives easier. So, our proposed solution aims to navigate diabetic patients to accessible resources with considerations to their social determinants of health and medical history. From our research so far, we plan to map the Trinetics electronic health records data with patients' data requested from Hershey Hospital based on zip codes. Then we will add features relevant to diabetic medical information and social determinants of health as much as possible in a way that serves our final model, NittanyNav. This will help us accomplish our goals of increasing efficiency of social workers and providers to connect patients to existing community resources. By being able to do this and connect our patients to these existing community resources that they might not have known of before or might not have access to before, we will be able to mitigate social determinants of health and therefore improve disease burden.
NittanyNav is a customized recommender system that considers a patient's medical history and related social determinants of health to create a personalized recommendation from a predefined set of local community resources. For our initial prototype, we plan to target reliable access to food for diabetic patients. The system can also be expanded to target other social determinants of health, such as access to healthcare in a form of transportation or financial aid services. The social worker then provide feedback for the system in order to help the model to learn how to make better recommendations in subsequent iterations. So how does augmented intelligence and recommender systems benefit us here? NittanyNav aids social workers in improving efficiency, resulting in an increased service provided to those seeking help. Also, the AI model will help trace patients' attributes, mapping them to resources more reliably. Initially, NittanyNav recommendations are validated through the social worker using it, for example, Sophie. Then, with further future development, it can utilize an individual patient's feedback for this purpose. This is our NittanyNav development timeline. Previously, we have already begun the process for data collection and have either submitted or begun drafting RBs for our project. We expect this phase to take around 2 months since we anticipate data pre-processing will require some effort. Next, we plan to spend a month developing our machine learning framework and train our recommender system model. Lastly, we plan to spend the last 3 months piloting our study and improving our model with users' feedback. For this phase, we plan on utilizing first-year medical students at PennState Hershey, who, as part of their curriculum, work once per week with social workers and patients to help them navigate the healthcare system.
So NittanyNav has the potential to be an immensely beneficial tool for social workers and any provider really engaged in helping patients manage social determinants of health. I think what makes our product really exciting is that it offers something unique. Certainly there are databases out there that offer resources to patients to help them navigate issues they're having in social determinants of health. But what we can do is offer personalized recommendations based on their social needs, their medical needs, and point them to direct specifically resources within their community. Another point to make is that we're offering relevant resources or able to identify what's relevant for the patient. Kind of during our research, for instance, we found one resource that listed transportation options to help patients get to their clinic appointments, to the hospital, anything to help with their diabetes healthcare. But actually looking through the resources, we found that a lot of them are just flights, as in airplanes. I mean, I don't think that would be particularly useful for someone who just needs to go down the block to get to their appointments. No one's taking flights to their doctors that I'm aware of, at least. So I think this is where we can really step in. And in that, kind of what we aim to do is to help social workers first. They're kind of the front runners in this ability to, I guess, help with social determinants of health. But ultimately, patients still remain the benefactors in our tool. So like any other tool, ours isn't perfect. There are limitations to what we're proposing. And first of all, this is prototype. We're building from kind of scratch at this point, but we are also relying on third parties for a list of resources. Again, this kind of has the limitations of sometimes they're not always relevant, but part of our program is that we are able to identify those that are and kind of be able to tweak our recommendations based on feedback from users. A second kind of point to make is that because we are a recommendation system, it does depend on continued and widespread use of our system to help make our precise recommendations useful for the user. And what we've laid out really is our our goal for the next few months in this project. However, the potential is much greater than what we're proposing here in future directions. There's no reason that we can't put this in the hands of patients directly. Here, we're keeping it to social workers, as in this case, we're able to keep a better eye on the process, make sure we're testing everything carefully and validate the methods that we're using. Additionally, we can integrate this into the electronic medical record. There's a wealth of information there that we can use to make better decisions. Additionally, we can expand across hospital systems to make this available to more individuals. And although we're focusing on diabetes to begin with, there's no reason we can't expand into other diseases such as healthcare, substance use disorders. So by this point, I hope you're excited as we are about seeing this tool move forward. But if not, these are kind of the points that we want to make sure that you understand. First and foremost, this is a tool that we hope to address social determinants of health. And in doing so, we kind of mitigate health disparities, particularly in diabetes. This is a tool that social workers can use to help their efficiency in tackling these issues as well. And by making these recommendations, we can better help patients connect to the resources within their community. For instance, again, we bring up a few examples such as transportation issues that we talked about, and also the food deserts that Kara brought up in the beginning. And by mitigating these health disparities, we're hoping to improve disease burden, particularly in diabetes, but again, it can be expanded across any disease that experiences these health disparities. And doing so, we're hoping to decrease the health system burdens that these diseases cause. So with that, that's our product, NittanyNav. I hope you enjoyed our presentation, and I hope you're excited as we are about this.
Great. So we will now move over to questions. Judges, please unmute.
Yeah, I'll kick things off. I really like this idea, and I agree with the notion that, you know, there's not a tight enough connection between health systems and social work systems, because a lot of care management that happens for patients actually happens outside of the hospital in a separate electronic health record that's not linked to hospital healthcare electronic records. We actually tried to do something similar a couple of years back, where we built a risk model using like several 100,000 patients worth of data to try to predict who is going to be a high utilizer. And then we had a human review, like a social worker review the top 40 cases every month and actually assign them to the appropriate community resource. The reason I'm bringing this up is twofold. I put some links in chat that I think you guys can see, the panelists can see. One was our model that we built, and one was our randomized controlled trial that we did on it. And the randomized controlled trial failed in part because we were doing this proactively, not linked to an existing social work relationship. Like we were blanket calling out people to say, hey, you look like you're high risk based on what we're seeing. You don't know me, but here's who I am. And I'm going to offer you housing, transportation, whatever. So people wouldn't pick up the phone. So the question, one of the things, so one is our trial didn't work. And actually a lot of predictive hotspotting programs haven't worked. And there was a big paper in New England Journal showing how, you know, if you do a before after analysis, they work, but if you do like a proper RCT, a lot of these things don't work in reducing visits or reducing like health utilization. On the other hand, though, the other thing we found is that the agencies we were referring to, like the little very tail end of the diagram, they're also overwhelmed. So they actually didn't have much bandwidth to take on additional patients either. So we thought like, hey, we're offering all these fresh new resources to our patients, but then we were doing it in partnership with those agencies, and those agencies were actually already kind of stretched thin. So I guess the question is really, you know, how do you prevent, like, how can you optimize maybe like, you know, like if you're going to order a mobile order at Starbucks, and if they're really busy, they won't let you do a mobile order. Like they actually block mobile orders. So is there some mechanism by which you can prevent or already overwhelmed resources in the community from getting more overwhelmed through your app?
Yeah, so I can address this a little bit and then some of my team members can jump in too. So we heard the same feedback from the social worker we talked to as well, that some of the resources that they go to are being overwhelmed by people using them. So I think for the prototype, we might not be able to address it in the prototype because we're just trying to test the idea. But once we get farther into development in the pilot study, we were hoping to collaborate with the community and with the people that run those resources. So it can kind of be like a dynamic list that's kind of like prioritizing, okay, we know that this has availability now. So kind of the feedback from the community is how we're going to address the overwhelming need of resources, people going to the specific ones and kind of being able to disperse them as necessary. So.
And going
Yeah,
further, one thing, you may want to actually get a community advisory board set up like right away. Don't wait till you have a product. If you have a product or a prototype and you're pitching it to them, it may be too late to gain their trust. Co-develop it with them because of these kind of issues.
I think also, I mean, with the tool, we'll be able to identify exactly like which resources are high demand. And I mean, I think with the community panelist, maybe with them, we can kind of discuss allocating community resources to help build those specific programs as well.
Yeah, and then in addition to that, for community resources, we have thought about this, right? Every hospital legally has to do a community health needs overview, like a CHNA, and that in the appendixes always list which community leaders, which resources they've used to identify these needs, and so that is going to be the repository of community resources that we will reach out to in order to collaborate.
I have a question, so more about the competitive landscape around this. So have you guys looked at so there's like companies like NowPow, and there's a few others that have now popped up in the last couple of years as this has become more and more of a, it's always been an issue, but there's more awareness around this issue. And so people have started to fill the gap. How does this differentiate from something like NowPow that uses the existing information in the EHR to then prioritize where the resources are needed and connect the resources? I think there are definitely gaps in what things like NowPow does, but I'm not completely seeing where this differentiates in filling some of those gaps that Karandeep also talked about.
So I might want to talk about this one. So in the available resources so far, you could see like there's some websites that one of them could be like Find Help, for instance. And if we could go for that slide, then let's say that our patient Mo is looking for transportation. The screenshot will show you how she enters her zip code. She presses search. She was looking for transportation, right? So she's gonna scroll over for that, pick transportation, and it's for healthcare. And then she's looking for a 3 miles distance this transportation, but all you can see here is air transportation, for instance. That might cause her hypertension as well. So yeah, but we're looking to have our system work around these type of incidents. So not having the patient do the work, or the social worker, in fact, not to go through that hassle. Anyone else wants to add in detail?
So are you I mean, just to add to his question, then are you brokering existing services? And you're right now showing that there's limited, right, services like the airline industry only. So in order for you to grow and continue having a platform that everyone's excited about, right, so you can get better adoption, are you adding up to other existing services, having to partner up with those, and then creating your own? Like, how are you going to navigate that portfolio of services or balance that out?
So our model essentially would work with, the prototype at least, would work with available database of resources. So we're going to try to find one category. So if we're talking about food, for instance, we're going to try to work around that category, looking for resources available. And with the model having to recognize which is the best recommendation or refine that, it will be closer to, it should work to be closer to what's the patient is actually looking for. Did that answer that?
And then I think addressing the portfolio as well, I think we're going to be collaborating with the social workers and also people in the community, whereas with Get Help, for example, which is one of the resources that we looked at. It was more just a list of things, and it didn't seem to be curated by the community. So if we're targeting the Harrisburg and Hershey area, so we'll be able to get a list of local resources that might be unknown to the public in general for sites like Get Help. And then for NowPow,